Welcome to Ultimate Skincare and Beauty Report. I'm Mary Winkenwerder. We prepare for many activities and events in life on a daily basis. The bigger the event, the more preparation needed. Sometimes the obvious can be overlooked. When this happens, situations can become something we did not expect. This also applies to preparing for any type of physical altering surgery. Joining us this episode is Dr. Jason Altman to share with us more about preparing a mental-emotional checklist before having plastic surgery procedures. Dr. Altman, welcome to Ultimate Skincare and Beauty Report.
Happy to be here. Thanks so much.
Thank you for joining us. Dr. Altman, we see the final results of plastic surgery procedures all the time, and they can be very appealing. These surgeries physically alter the body. What happens to one's emotions after surgery, and does the emotional body automatically respond to having plastic surgery or some sort of altering procedure?
Certainly, and it's a great question, and everyone thinks of plastic surgery from its physical aspects and how it changes your physical attributes, but the truth is, what we're really changing is your self-perception and your self-confidence. The goals of all of our procedures on the cosmetic side, not as much obviously on the reconstructive side, are to make people feel better about themselves. And so there certainly is always a strong emotional reaction, and obviously the hope is that it's a positive reaction and that we've helped that patient achieve the self-outlook and self-confidence that they were yearning for when they came seeking plastic surgery in the first place.
So what are some of the ways that a patient can prepare their emotions pre-surgery?
I think the most important aspect of preparation from a mental and an emotional standpoint for plastic surgery is to make sure that your expectations are realistic. And the best way to do that is by having a long conversation with your plastic surgeon in terms of what to expect, both in the short term, because obviously many of our results take time to achieve. You don't wake up from your surgery looking like you're hoping to look a month or 2 months, 3 months out. So being prepared for that healing phase and some of the swelling and bruising where sometimes you may look a little worse before you look better.
Right.
And I think very important is getting those realistic expectations, understanding what is and isn't possible with surgery. We can't do everything with our hands and with our tools, but we certainly can change a lot. But a big part of our job is speaking to our patients and explaining what is possible and making sure that what they're expecting from the surgery is what we can deliver.
Is it a good idea to get counseling before and after any plastic surgery procedure?
I don't necessarily think everybody needs counseling, but certainly a big part of my initial meeting with my patients is making sure that they are capable and stable enough to make the decisions to have surgery,
Sure.
that the motivations that are driving them to have that surgery are good but that the motivations that are driving them are also realistic and that they're not expecting something to come out of that surgery other than a physical change.
Right.
If they are expecting other life changes, marriage, job promotions, things like that, those are things we have to be very careful about and certainly not promise to our patients.
So should a post-op patient keep a journal of what they are physically feeling and also emotionally feeling?
I think it can be very useful. I think there are a lot of emotional ups and downs that come in that healing phase, both because many people have been waiting a long time for their surgery and been very troubled or disturbed by whatever feature of themselves they were hoping to have changed with that surgery. So there's a lot of elation, there's a lot of relief, and you combine that with the fact that there's often medications that you're taking, pain medications, anti-anxiety medications. These can throw the emotions off balance a little bit. So having friends and family members there to support you is obviously a great way to help. And keeping a journal is certainly a fantastic way, not only for you to keep track of your ups and downs, but to help you communicate with your physician, with your surgeon, and with your family and friends about what you're experiencing.
So when is it a good time to share your feelings or concerns with your nursing staff or with your surgeon?
I think any time that you're uncomfortable with them, anytime they're beyond what you would expect, certainly, the normal emotions of joy and some apprehension. Obviously, there can be some pain, some anxiety. Those things are all normal. But if they're getting to the point where you're uncomfortable with them, where you feel you're losing control of those feelings or emotions, you absolutely, and sooner rather than later, want to get your doctor involved, or wherever your support system lies in your life, you want to make sure that they're involved as well.
Fantastic. All right, Dr. Altman, where can we catch up with you and your practice online?
We are at the Plastic Surgery Institute of Miami in Coral Gables, Florida. The website is www.psimiami.com or just plasticsurgeryinstitutemiami.com.
Wonderful. All right, Dr. Altman, thanks so much for joining us. It's been great having you on the show.
It was a pleasure. Hopefully I'll be back soon.
All right. Catch up with me on my blog, www.beauty.report.com, and on Twitter @BeautyPublicist. Everyone, thanks so much for joining us on Ultimate Skincare and Beauty Report. Have a beautiful and successful week. Mwah.